My name is Jennifer Trytten, and I'm Director of Infection Prevention and Clinical Performance Improvement with Community Medical Centers. A question I get asked sometimes is, what is infection prevention? It is a department in the hospital that is staffed with trained and certified infection preventionists, but it also is all of our other staff members who incorporate infection prevention practices into their daily work. But it goes beyond the hospital walls too. Infection prevention is what everyone in our community needs to do to make sure that they're keeping themselves and their families safe. So COVID has certainly highlighted the importance of understanding these infection prevention principles. We all knew to wash our hands, but there's never been a more important time than now. With the current surge that everyone's, I'm sure, seen in the news with increasing numbers in our community and in our hospital, it's the time that we have to be the most vigilant. We're also concerned about the coming flu season, and while we're lucky that we haven't seen cases really locally yet, we know that that could be coming with the colder weather in the coming months. So we're hoping to avoid a twindemic and keep everyone safe. So we're really appreciative of everyone's efforts to keep themselves safe from the flu, things like getting the flu vaccine, and then all the other things that people are doing for COVID will be effective for that as well. So our frontline staff have been amazing through the last 9 months. They've given of themselves tirelessly, but we're at the moment now where we really need to turn to all of the others in our community and think of them as our frontline folks. It's like a bathtub that's overflowing. We need to turn the faucet off. So we need people to be safe at home and to do just the basic simple things that we've been talking about for months. We know that everyone's got a little bit of quarantine or stay-at-home fatigue, but now's the time more than ever to be safe. So it's the essentials. It's the wearing a mask whenever you're outside of your home. This includes places that maybe previously you thought it was safe to not wear a mask. People might be surprised to think about that even wearing a mask in your car or at home are safe practices, especially if you're picking up a family member who's traveling from another area. That's a really important time to make sure that you can continue to stay safe and wear a mask. Social distancing. Sometimes we think that if we're wearing a mask, we can get right up next to each other. Wearing a mask does not keep us from needing to keep that 6 feet of distance from other people that are not in our household. And one of the hardest things these days is avoiding get-togethers. So if we can try to come up with ways to connect virtually with gift exchanges that we do separately but get together in videos, that's really a safe way to go. Staying home if you're sick. Of course, with the stay-at-home order, most people are limiting their travel, but you need to even be thinking about it even more for those trips to the grocery store, etc., when you have any symptoms at all. Washing our hands and using hand gel, making sure that we're using those practices whenever we're out. And then watching out for others. So many of us may have incorporated really safe practices into our daily routines, but keep an eye out for those family members or those friends. And anytime that you're seeing that maybe there's something that they're not recognizing is making them vulnerable. So again, we're 9 months in. We do have some light at the end of the tunnel with the coming vaccine. So we hope that everybody will do everything we can to make sure that we'll all be together to celebrate when this is all over.